Can you please do mirtazapine? Yes, it's one of my favorite antidepressants actually. So here's what it looks like. And if you notice, there's like these 4 of these circles here. Those are called cyclohexane rings. So this is called a tetracycline antidepressant, as opposed to TCAs, which are tricyclic, which have 3 of these. Tri is 3, tetra is 4. Now mirtazapine is only FDA approved for major depressive disorder. But remember, FDA approval is not usually worth seeking for a pharmaceutical company if the drug is off patent. So despite the fact that it's FDA approved for only one thing, this is usually what it's used for: generalized anxiety disorder, social anxiety, obsessive compulsive disorder, panic disorder, PTSD, low appetite, insomnia, nausea, vomiting, itching, headaches, and migraines. Mirtazapine interacts with a whole host of receptors, but there's 4 major receptors that really it acts on. It antagonizes the alpha-2 adrenergic receptor, which enhances down the line more norepinephrine and more serotonin, the serotonin 2 receptor. And the antagonism there actually specifically studied for use in lowering drug-seeking behavior in people with substance use disorders. The 5-HT3 receptor, which is serotonin 3, antagonism of that causes a decrease in vomiting and nausea. It's like Zofran. And the last receptor is the H1 receptor, the histaminergic receptor. But what's nice is that it has a low affinity for the muscarinic acetylcholine receptors, which cause a lot of the anticholinergic side effects, even though these side effects can still appear with mirtazapine. Now, the reason why I like mirtazapine so much is for multiple reasons. One, it has an effect immediately when you start it. Usually, people with anxiety or depression have issues with sleep. Mirtazapine, first time you take it, it will knock you out. And it's not habit forming. And that knockout feeling does not necessarily persist at the same intensity throughout the entire time. Your body acclimates to it quickly, but you get into a regular rhythm of good sleep. A lot of times people with anxiety or depression lose weight, they have no interest in eating or can't eat. Mirtazapine can help boost appetite. This is especially useful in elderly people. When they get depressed, they typically don't eat, and that can be very dangerous. Mirtazapine also has a much lower risk for sexual side effects as opposed to other SSRIs. And lastly, mirtazapine does a really good job when it's combined with something like an SNRI like venlafaxine or even something like Wellbutrin. Because Wellbutrin kind of sparks you up and mirtazapine brings you down, while both increasing norepinephrine and serotonin. So yeah, I'm a big fan of mirtazapine. When it works, it tends to really work. Let me know if there's other meds you'd like me to discuss.